Hello and welcome to Module 1, Lecture 2, Part 3. Um, in the last lecture, we were talking about your assignments that you'll be doing in this class. Even with the big projects, the website, the infographic, and the video, we'll also be doing weekly discussions, weekly reflections, so definitely still look out for those. Um, so just wanted to sort of go over with you your first chapter of your textbook, Serving the People, Body and Soul. And wanted to start out with letting you know that there is a really useful list of abbreviations at the beginning of every chapter. It took me a little while to notice that, but it was really helpful. Um, Another thing that was really important in chapter 1 that wasn't addressed too much, but I would love you to explore further is the Tuskegee syphilis study. So it's one of the most infamous human rights violations undertaken in the United States in the name of medical research. I'll show you this link to, it's actually a really excellent article. So as part of this lecture, I would like you to read this article, listen to the podcast, and explore. I tried playing the podcast on the lecture, but it sounds not very good. So I would like to encourage you to listen to the podcast and explore this part of American medical history and public health history that actually was instrumental in laying the groundwork for the medical civil rights movement and um, how this movement was a reaction to the unabashed racism that was entrenched in the medical system, medical practices um, of that time. And so the medical civil rights movement was really important in the inclusion of Black providers, doctors, nurses into medical education and schools and working in health centers, as well as making the medical establishment a safer place for Black Americans to receive healthcare, which from the syphilis study, you can imagine when it came out in 1972 was shocking and and just terrifying for Black Americans who ever took part in the medical system. So the medical civil rights movement set the groundwork for that, and so did the United Nations Universal Declaration of Human Rights, which was also a major instrument for the Black Panther Party health activism, as well as the World Health Organization Constitution. I encourage you to look at both. They're both really important frameworks in public health, especially rights-based public health. And so these two documents, as well as the medical civil rights movement, shaped the party's praxis or practice in application of theory or political ideology, which when I say praxis, I really mean their talk about community survival and equity and inclusion, things we still talk about today in community health and public health. And I've seen very few groups in history that actually really pulled off equity and inclusion and made it a reality. So their ideas became truly a practice. And And so I appreciate the word praxis in this book. The politics of the time, so the Civil Rights Act of 1964 and the Voting Rights Act of 1965 were really important in this time period, and these were essentially outlawing discrimination of Black Americans in voting and in employment, labor, housing, and other aspects of citizenship. So these were really important. The Social Security Act was establishing Medicare and Medicaid um, as safety nets for health. The Health Maintenance Organization Act of 1973 still is relevant today and laid the groundwork for our HMOs that we have today, and I encourage looking through all of these in detail, looking them up if you don't know a lot about these. I wanted to touch on Jim Crow, and this term has come up quite a bit in the book, in chapter 1 briefly, and it'll keep coming back. And this is a term describing laws designed in the 1860s, so 100 years before this book takes place in the 1960s, to prevent newly free Black Americans from exercising their basic civil rights. For further clarification of the background and context of Jim Crow, please, and the laws, please look at these two videos. One is pretty brief, one is in depth. And I just wanted to circle back to how Jim Crow laws came into existence a long time ago, but never became outdated, because in the era of more progressive laws and legislation being passed, the Jim Crow laws also came about to counteract the civil rights, voting rights, Social Security, and create barriers again and again to stop the progression of civil rights. So I wanted you to just take note of that, and how these concepts, like the work of the community survival, which was a movement, which was a lot of things, but it was a movement towards provision of free resources to account for segregation, inequity in medical and social services. It was also there to counteract the extreme police brutality in Black communities of the law enforcement. So community survival is a term and a concept that was really important in the health activism of the party. And tactical repertoire, I like this word, using the history of medical discrimination as an advocacy platform, which I think this is how Nelson uses this word of tactical repertoire. But really what I would like us to do while reading the book is learn how we can use the stories of medical discrimination and histories of communities that we work with for advocacy. Citizenship contradiction, we'll be diving into that in our reflection, the gap between civil rights and social benefits. Social health, I thought that Nelson put this in a beautiful way, an outlook on well-being, scaling from the corporeal body to the body politic in a way that therapeutic matters were inextricably articulated to social justice ones. So what she was saying was basically how the party took an approach to health that included social and political systems that were preventing people from accessing care. So not only were they giving treatment and medicine and care to the physical bodies of people who came through their doors at the People's Free Medical Clinics, but they were also taking care of the social conditions and working for the betterment of, and yeah, the conditions that got them to be sick in the first place and that were creating the poor health and disparities on a on a larger level than an individual's health. So, and I also just wanted to distinguish racialism from racism, so I put that here. And racialism was a theory that, and I think it still exists, a theory that race determines human traits and capacities. And if you can imagine how destructive racialism is in when trying to dismantle racism and fight for equality and equity, and racialism is a pseudoscience or fake science that comes in the way of establishing justice. So important party figures in Chapter 1. Huey P. Newton and Bobby Seale, founders of the party. Elaine Brown is the chairwoman. Stokely Carmichael, H. Rap Brown, and Kathleen Cleaver started with SNCC leadership, the Nonviolent Student Committee, but they came forward and became big members of the party. Che Guevara is a physician and freedom fighter. There's a lot about him out there if you're unfamiliar. Mao Zedong, chairman of the Chinese Communist Party and leader of the Cultural Revolution in China. Frantz Fanon, psychiatrist, wrote about the psychology of decolonization after visiting Africa. And Fred Heistan was the attorney of the party, and Emory Douglas, I had the privilege to see a talk of his at University of Delaware in 2010. He is the party minister of culture, but he's also just a really talented artist who used his talents for advocacy and social justice. So Chapter 1, just wanted to recap some of the major points for me, which were the Community Survival Conference that came about in 1972, which is also the year the Tuskegee syphilis study was exposed. This was in Oakland, California, where the Serve the People, Body and Soul slogan came from. So this is where they announced their community survival programs and sort of changed their lens from more of a political group to just being like political activism through taking care of the community. And so this was a major community health example to all of us, and just a model for the things that they did: senior citizen support, free elementary education, bus services to prison visitation, free food and clothing, grocery giveaways, voter registration drives, and the People's Free Medical Clinics, which were staffed by experts, doctors, nurses, who are all volunteers, community-based. The health services extended to outreach, education in the clinic, outside the clinic, public spaces. They took vans and ambulances out to poor communities to bring health care where people had no access. So huge example to me of what community health can be, and you know, just its potential for people to take charge of their own community and bring healthcare and health and social change. So your first reflection, citizenship contradiction. You can see the prompts here as well as on Canvas, due by the end of the week. And if you have any questions, please feel free to contact me. I'm here on email. During office hours, you can call. And looking forward to seeing you for Module 2.